social justice awards. So my name is Will Ginobili. I'm the Dean of the Harvard School of Dental Medicine. And so we're very delighted to have this opportunity to host the keynote lecture and this award ceremony here at HSDM. And so we really have these strong partnerships with the medical school and with the School of Public Health. And so it's really nice to bring you into our community here at the Harvard School of Dental Medicine. So as we come together to honor the remarkable individuals who are recipients of the 2022 Equity, Social Justice, and Advocacy Awards at Harvard Medical School and the Harvard School of Dental Medicine. So our awardees are comprised of faculty, staff, students, and trainees, and their efforts reach beyond the constructs of their roles and concentrate on an array of areas needing focused attention. Not only do their efforts affirm the HMS mission, community values, diversity statement, and medical professionalism, they also exemplify the change we work to see at Harvard and beyond. So it's our pleasure to have our keynote speaker here today, Isola Ajakutu. And Dr. Reed had shared with me that she's one of the esteemed graduates of the Commonwealth Fellows Program. And so we're very pleased to be a part of this program connected with the Joe Henry Scholars Program at HSDM in the development of a community of leaders in the profession. So it's our pleasure to welcome you. And then now I'm going to turn the podium over to Dr. Joan Reed, the Dean for Diversity and Community Partnership and Professor of Medicine at the Harvard Medical School. So thank you so much, Joan.
Thank you very much, Dean Ginobili. I think that today's program will leave us all very much inspired and motivated to both acknowledge and create change. It's an exciting day. For those of you who are here in person and online, I also want to bring you greetings from Dean George Daly. I am hearing an echo. Do others hear it, like a sound in the background? If I had that much power in the world, I would not. All the things I would do. But from Dean George Daly, he's not able to send his congratulations to the board recipient and his appreciation to Dr. Ojakutu, our keynote speaker. A few housekeeping issues as we begin. You know that this program is both in person and online. The chat function, however, will not be available online. Please keep your microphones muted. And we ask that you use the Q&A function to ask questions of our guest speaker. This is live closed caption, and that will be available today. And at the end of the webinar, there will be a poll of questions, very few questions, short answers, and please take the time to do that. In a few days, this recording will be posted on our DICP, Diversity Including and Community Partnership website. And now, in terms of framing this is the second year of the Equity, Social Justice, and Advocacy Award. In 2020, 4 committees were charged with taking deep dives into focus areas of diversity with the spectrum of our Harvard Medical School community as part of our Better Together plan. One of those ad hoc committees was around equity, social justice, and advocacy, and was co-chaired by Dr. Dwayne Pursley, an associate professor of pediatrics and chief of the Department of Neonatology at the IDMC, and Dr. Alexia Rouse-Boudreau, who is an assistant professor of pediatrics at Massachusetts General Hospital. And I thank that committee that had faculty, staff, students, trainees across our community for this concept of an equity and social justice award. And in this, our second year of the award, I'm happy to say that we received more than 100 nominations on behalf of faculty, staff, students, and trainees. Each nomination was reviewed by an advisory committee with representatives from across our medical school and dental school communities, as well as members from our HMS affiliate. All nominations were compelling and are a testament to the dedicated work of respect, fairness, justice, advocacy demonstrated by the nominees, and also their personal passion and commitment. After an intensive review, 10 honorees were recommended for this year's award. We thank all of the nominees and the nominees, and we begin this by congratulating the 2022 Equity, Social Justice, and Advocacy Award recipient, and you'll hear more from this shortly. But we begin with a presentation honoring the commitment to health equity and social justice by our presenter today. Dr. Ojikutu is a nationally recognized physician leader, health equity researcher, community advocate, and expert in the prevention, care, and treatment of infectious disease. As executive director of the Boston Public Health Commission, the city's health department, she manages a budget of $162 million and leads 1,200 employees to protect, preserve, and promote the health and well-being of all Boston residents, particularly those who are most vulnerable. She's a key advisor to our Boston mayor on health issues and builds innovative partnerships across city departments and across Boston communities to positively impact the health of all of our city residents. Among other public health priorities, she is committed to addressing racism as a public health crisis and to advancing health equity. Dr. Ojikutu is an associate professor of medicine at Harvard Medical School and a faculty member within the Division of Global Health Equity at Brigham and Women's Hospital. She has an additional appointment at Massachusetts General Hospital and the Family Institute. She's led research and developed programs focused on increasing access to healthcare among marginalized populations. Research that has been funded by the National Institute of Health, PCORI, Patient-Centered Outcomes Research Institute, and HRSA, Health Resources and Services Administration, HIV/AIDS Bureau. Most recently, she served as director of the Community-Based Research Program and as associate director of the Bio-Behavioral and Community Service Board for the Harvard Center for AIDS Research. Widely published in peer-reviewed journals, he's also co-editor of 2 comprehensive textbooks detailing strategies to address the ongoing HIV epidemic within Black and Latinx communities. Her international experience includes directing a project that provided program management, strategic planning, and technical assistance to improve HIV care and treatment in 15 countries in sub-Saharan Africa and Latin America. A graduate of Johns Hopkins School of Medicine, she also completed an internal medicine residency at New York Presbyterian Hospital and the Cornell Infectious Disease Fellowship of Massachusetts General Brigham and Women's Hospital. She's an alumna of the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University, and with that earned her master's in public health policy and management from Harvard PhD Chairman School of Public Health. You're just all over Harvard. Board certified in internal medicine and infectious disease, also fellow of the Infectious Disease Society of America. And with that, I bring you the message from Dr. Ojikutu.
All right, good afternoon, everyone. I wanted to first thank Dr. Reed for that kind introduction. I don't want to stop there, though, in terms of my thank yous to Dr. Reed. She's really an amazing leader, and I am lucky to call myself an alumni of the Commonwealth Fund Program in Minority Health Policy. you'll see throughout this presentation that there are a number of fellows who I've worked with and a number who are making extraordinary impact across the country as well as globally, as I understand it. So very proud to be included in her cohort of fellows. I'm honored here to be here today to celebrate individuals who have really chosen to center their work on social justice, equity, and advocacy. From my perspective, meaningful change in the world really only occurs when someone has the courage to speak up and say something that's somewhat unpopular, to do things that people haven't thought of yet, and to really be unselfish in terms of designing goals and really attacking problems. And that's what I see advocacy as. I mean, that's really what advocacy is. I think that what I would say first and foremost is that I commend you all for your advocacy, because I really do think that it takes bravery to do that in terms of your career. So I wanted to talk today about work that I believe is somewhat brave, certainly not just led by me alone. Some of it preceded me in my role as, Commissioner of Public Health in the City of Boston. But it's all of it is really about collaborations here in Boston, led by the Boston Public Health Commission to address racism as a public health crisis. As many of you probably know, numerous cities and counties, more than 200 actually, have formally declared racism a public health crisis across the US. And this movement actually began pre-COVID. So around 2018, Milwaukee County in Wisconsin declared the first, racism as a public health crisis, and said that's their initiative. So they led the way. And then this process sort of accelerated following the tragic murder of George Floyd. And much of the work, rightly so, has focused in on policing and police reform. But I do think that the evolution of the movement has been very interesting in terms of what it's meant for public health and what it means for those of you who are interested in infusing, public health practice into your careers. I'll share with you that it was very striking that at a recent meeting, probably about 35 commissioners of public health across the city, across sort of the largest public health departments in the US, we were in a room and we were asked to raise our hands if our jurisdiction had officially declared racism a public health crisis. And most hands in the room were raised. Then we were asked if our health department actually received funding to support this declaration. Very few hands were raised, including mine. We did receive some funding in Boston, and I'll tell you a little bit more about that. But then we were asked to raise our hand if we thought the declaration of racism as a public health crisis was largely symbolic. And essentially every hand in the room went up. Several commissioners, and I thought this was quite funny, emphatically raised both hands. So the question is, what does all of this really mean? What does it mean when you have a declaration and you need to act? And so what I'm going to do is I'm going to talk a bit about this, but I would like to share that none of this is really surprising in terms of the symbolism of this versus the actual action. The American Public Health Association has been documenting these declarations over time. And what they state, and I quote, is that the declarations themselves are often symbolic, but what has impact and creates change is turning advocacy and symbolic gestures into action. And so again, I think that what I'd like to emphasize is how we here in Boston have actually taken clear action. So I will focus in on some of the work, not only that we've accomplished, but things that are still in the works. So we still have work to do. But first, I'd like to tell you a little bit about my own personal journey to the local health department. I think the first question that people often ask me is, how did you get here? Why are you leading the Boston City Health Department? How did that even work? So that's probably a longer conversation than I can embark on here. But what I will tell you is that a lot of my perspective and experience has come from my work in global HIV. And Dr. Reed mentioned some of this. After completing the Commonwealth Fund Fellowship in Minority Health Policy, I moved to South Africa and lived there and helped jumpstart a lot of the PEPFAR, the President's Emergency Plan for AIDS work that Harvard and MGH and the Brigham were initiated. And this was a great experience, really transformative for me, working with ministries of health, scaling up critical HIV programming, and really leading community engagement. I actually ended up staying in this world, the world of global HIV, and I ended up working in 15 different countries on USAID funded projects. But what I noticed, even though I was working in many different countries all over sub-Saharan Africa, is that I was seeing a consistent theme just over and over and over again. It was structural violence. No matter where I went, what I was seeing was what Paul Farmer has described as the multiple ways in which social, economic, and political systems expose populations to risks and vulnerabilities leading to increased morbidity and mortality. And really that has shaped my worldview and how I try to lead the health department to overcome some of these as we try to move programming forward. I think that what it really has done though is made me stop and think a lot about inequity. And you see here, this is Durban, South Africa. And on one side of the screen, you see suburbs of Durban. And on the other side, you see Mlazi, which is a township in Durban, mostly Black people living there, not all Black people living there, mostly white people living in the suburbs. And so is that something that we see here in the US? Well, of course, here we have Boston and we have the Back Bay versus we have Roxbury. Many of you all probably remember the study that was released back in 2012, which noted that there was a life expectancy differential by census tract, Roxbury versus Back Bay, of upwards of 33 years, which is quite shocking. Now, I'm going to tell you a little bit more about what we're doing in terms of life expectancy data, but I think the point here is that we have a lot of work to do in regards to structural racism. And oftentimes, when you think of structural racism, you have these very wordy, verbose definitions. Okay, a system in which public policies and institutional practices, cultural representations perpetuate racial inequity within social, economic, and political systems in which we all exist. And sometimes you just can't wrap your arms around it, especially if you're in training and you're trying to figure out what does this mean for me? What is it that I can do about this? I'm going to break this down and just be really simple. It's a system of hierarchy, it's a system of privilege, and it's a system of power that excludes non-white individuals. So if you think about it that way, I think that it helps. As you see it, you can identify it, and you can try to figure out ways to get around it. So turning back to this issue of life expectancy. So if it's still 33 years by census tract, well, I have to say, we got to put a pin in that. We're working on that data. But what we do have is neighborhood level data. And it's not as striking, but it's certainly important for us to understand. So what you see here is Boston neighborhood, and this is life expectancy 2016 to 2021. And you see it's lowest in Mattapan, which has the largest Haitian-born population. You should know Mattapan, take some time and go there, lots of shops, lots of things to see in the Mattapan area. Low life expectancy. Compared to Back Bay, Beacon Hill, and other neighborhoods that we've sort of aggregated together here of a life expectancy of 86. So 76 versus 86. And then when you look at it by race and ethnicity, you have Boston total being around 81 years of life, whereas on average, Black individuals live about 75. We do need to get this data by census tract because you have to drill down. You really can't look at things at these large, geographic areas. We really do have to understand that. So we will be posting that data hopefully early next year. Again, this is really what we're seeing here is about structural racism and systemic inequity. But what are the other manifestations that we see specifically here in Boston and certainly other places across the country? Well, you all know about redlining, and this is the original 1936 FHA map that you're seeing there. And then you all know about the carceral system and the disparities in terms of incarceration. And then I also included here, immigration policies, and this was a protest about Haitian migrants, and certainly we're continuing to see many issues with regards to the xenophobia, racism, and regards to immigration. And then, of course, we have inequitable employment policies. So lots of manifestations of structural racism everywhere we look, quite honestly. So then when it comes to declaring racism as a public health crisis, what do you do first? There's so many things. And when former mayor declared it, he gathered together lots of people and they tried to figure out, so what do we do? Where can we make tangible change? Because that's what you want to do, right? You don't want this to just be symbolic, you want this to be meaningful. So I have to give him an enormous amount of credit and say that he came up with a lot of thoughts about how to, address racism as a public health crisis. And a group of individuals, some Commonwealth Fund fellow alumni, developed this Health Equity Now plan. And he specifically targeted these 8 strategies related to public health. And a lot of stuff is here, right? Just like I said, there's a whole lot of stuff that we could be doing to address structural racism, almost overwhelming. Then how much money did we actually get? The things that Mayor Marty Walsh wanted us to address, and we would probably need a whole lot of money to address them. Is that right? So if you look at Boston City's budget in 2020, it's about $3.5 billion. If you look at the BPHC budget in 2020, it was about $162 million. Okay, right now it's probably about $200 million. The amount of money that we got to address these issues was actually only about $3 million. Now, if you think about health departments, even if you haven't worked in one, $3 million is not a lot of money. It doesn't go very far. So going back to that meeting that I was at, where the 35 commissioners were sitting around, yes, I was one of the people, but this is symbolic. Okay, this is not going anywhere. But my predecessor really made a strategic decision that I think was quite important. What she said was, you know what, we can't tackle all of this. You know, there's no way. You know, $3 million, even if we get $3 million every year for the next 2 years, we can't tackle all this. But what we can do is we can get our own house. We can fix our own public health department, not structural racism, but really institutional racism. And we can dismantle the barriers that are right here within our public health department that change how we actually engage with communities, how we manage programs, how we actually bring people in to have equitable community engagement, all of these things. And this was kind of her vision, which I, had totally tried to move forward, and I'm hoping that we can do more. And I'm going to show you a little bit about that. But I want to start by telling you a little bit about the Boston Public Health Commission, because as a city health department, you may not know this, public health actually finds its roots here in the city of Boston. And that's because the Boston Public Health Commission probably is the oldest health department in the country. Now, we get pushback on it. Okay. So, Philadelphia completely, they say, what are you talking about? So, but this is actually true if you look at the data. So back in 1799, you all heard of Paul Revere's, we didn't just take a ride. He actually, did some work in regards to smallpox and yellow fever, really some critical seminal work in regards to managing infectious diseases, and he became our first commissioner in 1799. Now, what the Boston Public Health Commission has been known for over the years is really that critical health work that we all sort of think about, like tobacco regulation, maternal and child morbidity in health. We actually have the first ambulance service in the entire country that's within, now it's called Boston EMS, it's within the Boston Public Health Commission. In addition, we've been forerunners in terms of harm reduction. So even before people were calling it harm reduction, we were passing out needles and we were engaging people and we were doing all the things that people should be doing in terms of substance use disorder. So this is really what the Boston Public Health Commission has been all about. Now, that's not to say that my predecessors haven't been thinking about equity and haven't been thinking about racism. We've had wonderful commissioners in the past of Boston Public Health Commission, but it's really what we're known for, that we have been leaders in a lot of the sort of critical foundational public health work. So since my predecessor said, okay, we're going to take this $3 million from these declaration funds and we're going to do something with it, and I'm going to do something that I can wrap my arms with. I'm going to work right here internally. That started in about end of 2020 and then into my term 2021 as being commissioner. And a lot of really key things have been done. Now, this may seem routine. You're like, oh, this is obvious. You're budgeting for equity, equitable procurement, race and ethnicity data collection. I'm sure we all know what happened throughout COVID in terms of the data that we were getting from the CDC. Honestly, Boston City had some of the best, most complete data in regards to race and ethnicity, 95 to 98% complete for both cases and deaths in regards to COVID-19. This year, we're doing all staff anti-racism training. We have workforce development programming. We have an equitable community engagement plan, really things that should be standard across public health departments. And this is what we did to get our own house in order first before we look externally. So what I want to say, though, is that there are a couple more things that I know we need to work on. And I think Dr. Reed actually mentioned our mission when she was introducing it, to protect, preserve, and promote the health and well-being of Boston residents, particularly the most vulnerable. Did it say anything about racism? No. Okay. Doesn't really say anything about equity either. So we're changing this. The mission is going to be to work in partnership with our communities to protect and promote the health and social well-being of all Boston residents, especially those impacted by shelter-related systemic health inequity. I think this is an intentional statement. It's powerful. Some people may say, well, that's just a statement. No, it's not. It really is the branding. It's telling you what your department is going to be about and what your activities are going to focus on. It's the intentionality that really matters. So this was actually developed by our Racial Health Equity Advocacy Committee, our ORC, which is the Office of Racial Equity and Community Engagement, and we'll be moving this forward early next year. But it's interesting though, because we can do all these things, all the things that I mentioned, and we can change mission statements. But what about leadership? What does our leadership actually look like in the commission? So this is that group of 35, I think it's fewer than 35 here in the picture. We met recently with Dr. Walensky, and we were talking about issues related to local public health versus what's happening at the CDC level. And one of the things we talked about, we just sort of debriefed each other on how we were doing, how things were going. And one of the commissioners in the room said, this is tough. this is tough work because I'm the first Black woman to be the commissioner at the health department. This is one of the women in the picture. And she said, people don't think this is what leadership actually looks like, which is odd to me. I thought it was odd because I sort of always was and maybe part of this is being a Commonwealth Fund fellow. I always saw Black women doing this work. But at the health department level, that isn't what is necessarily happening across the country. And to be quite honest with you, prior to going to this meeting, I was talking, we actually went to APHA and gave some comments at the opening plenary. And I was trying to get a history of who's actually been the Commissioner of Public Health here in Boston. And quite honestly, I found out that I'm the first Black woman to be the health commissioner in Boston. Now, remember I said 1799. So that's 222 years. But here I am. I certainly won't be the last, but I wanted to make that point because it really is about thinking intentionally about who your leaders are. And Mayor Wu has taken this to another level. She put the Boston Public Health Commission and myself on her cabinet. I think it's been incredibly important to have us right there at the table, but she's also diversified the entire cabinet. And this is really the most diverse cabinet that we've ever seen in Boston. And I think that is really impactful to see people who look like the people who are residents in Boston sitting at the table making key decisions. So I think that's really important. So I'd like to talk a little bit and give you a few examples about what we've done since we started to get our own house in order. Because now we're looking externally and we're trying to think about structural racism. So I do want to give you a few examples of some of the things that we've done. So one, let's talk about masking. Now masking, as you all know, has been a politically contentious issue. This particular study, because it was well done, but it was also sharing our experiences and what we did in terms of lifting universal masking experience, why we did it, why it improved outcomes, because it was so contentious and such a sort of hot button topic. It was published recently in the New England Journal of Medicine, but let me tell you what it was about. So essentially, February to March of this year, most schools in Massachusetts ended required masking for staff and students. 2 school districts, Boston and neighboring Chelsea, actually maintained their requirement. So that set us up for a national experiment. We could actually take those data from those school districts and see, does it really make a difference? I think we all, we're all medical folks, we know it made some difference, but in this world that we're living in right now, where there is, contention around mitigation strategies, it's important to document that. So our study objective was to determine the impact of school masking policies on COVID-19 among students and staff. Okay, so what did we find? So initially, pre-lifting, our rates in terms of COVID-19, student, staff, in school was similar across the districts. Post-lifting, the rates clearly diverged with higher COVID-19 cases among districts that removed their universal masking requirements. So actually, during that 15-week period that we studied, the statewide masking policy was rescinded. The lifting of masking requirements was associated with an additional almost 12,000 cases. So that's an interesting finding, but what the heck does this have to do with structural racism? Because that's what I was talking about. So if you think about what happens in our public school system, the experience in our public school system, very different from that in our private or other parochial schools. It's really been shaped by structural racism. We have infrastructure for air quality, for HVAC systems, more crowded classrooms, limited staffing, staff shortages and challenges that made tracking cases, following up, doing all the things that we need to do to keep kids and staff safe, very difficult. And so what we did intentionally wasn't that, we wanted everybody to mask. We were actually thinking critically about structural racism. We were thinking critically about inequity. And we said, we are going to extend masking to mitigate the impact of structural racism in these schools and to improve health and wellness overall. And that's why we did what we did. And so when you start to think about racism as a public health crisis and what it is you can do about it, you can just be intentional about your decision making. And I think that's the key piece that I wanted to use here in terms of this example. I want to give you another example. So how many people are familiar with what we call mass and pass? Okay, everybody is familiar with that. Good. So this is the neighborhood surrounding Mass Avenue and Milligan Cass Boulevard. And those triangles that you see in the blue triangle, that was our tent encampment that existed for several years prior to January of 2022. So prior to January of this year. So probably, I would say about 250 people would congregate in the area, hundreds of people living inside these tents. Very dangerous to live inside these tents. Lots of lots of activity that was very dangerous for people was going on with the camp. Okay, so we knew we had to deal with this, and we knew we had to deal with this aggressively. So what happened here was that the mayor of Boston hired one of the former Commonwealth Fund fellows, Dr. Monica Burrell, former Commissioner of Public Health for the state of Massachusetts, to work with us at the City Health Department, Boston Health Commission, and to work with the Mayor's Office of Housing, and to do something that hadn't really been done across the country. And that is take everybody who's living in these tents and find them a place to live. Okay, so every single person living in a tent had some place that they were offered to go, and not just a roof over their heads, but actually what they were given was case management, housing navigation, harm reduction, access to detox, if that's what they wanted. All of this in sort of a housing first program. Again, this is not being done across the country, so very novel in that this happened. And again, kudos to Dr. Burrell to lead us through this process. What structural racism? Because again, I want to get back to the point of all this. Well, if you look at structural racism and substance use and homelessness, oftentimes our media representations are white, at least right now, they're white. Okay, and it really is focused in on opioids, not necessarily on substance use necessarily. But if you look at the population who actually lived on Massive Castle, who are living there now, because we still have people living there, just not in tents, 61% were actually people of color. So 30% Black, 31% Latinx. We know that there's a disproportionate burden of substance use disorders among Black, Latinx, and indigenous populations. We know there's an overrepresentation of Black and Latinx individuals experiencing substance use disorder amongst the homeless population. And recently we've seen increases in overdoses among Black individuals, particularly Black males. So what did we do intentionally? Equitable access to all of this housing to everybody, to make sure that we didn't end up in a situation where we were promoting structural racism as opposed to eradicating it or addressing it. We're also working to ensure community engagement and to ensure that there is a decrease in substance use stigma, which is quite prevalent in certain communities. And lastly, I do want to thank Congresswoman Ayanna Pressley, because we were able to get a 3-year OMH grant to continue to focus on this, because we can't just do this on a one-time basis. We need to continue to focus in on structural racism in the work that we're doing to eradicate or to deal with substance use disorder throughout the city. So lastly, I want to say a few words about COVID-19. Now, I know we have pandemic, but I do think there's something to be said about what we've seen here in Boston and that we haven't truly acknowledged. So this is the cumulative percentage of individuals who are fully vaccinated here in Boston by race and ethnicity. About 81% of our population is fully vaccinated. And all of us in this room were probably aware of and concerned about the racial and ethnic disparities in uptake of vaccine early on as vaccines were rolled out. As of April of this year, the Black-white, Latinx-white disparities were actually eliminated. So how did that happen? Well, you know, I think I would be limiting this discussion if I didn't say that it was multifactorial. Certainly, lots of different things changed. We increased access. We did a lot of work working with community-based organizations, which I will show you. But what we did intentionally is that we focused on trust. And mistrust, which I'll talk about, is a key manifestation of structural racism. So a lot of people talk about this over the years, you know, the pandemic, this lack of trustworthiness and mistrust, which has led people to not want to do the mitigation strategies, to not uptake a vaccine. And I think that that's been incredibly important for us to focus in on. But where does that mistrust actually come from? Well, it's rooted in historical and contemporary racism. Systems and institutions that have not been trustworthy, more illness, worse outcomes, premature deaths. I really highly suggest that you read Medical Apartheid. If you don't read the whole thing, just read several chapters to give you a better sense. It isn't just about Tuskegee, certainly it isn't just about Henrietta Lacks. This has been centuries of the making. And I think that what people don't really pay that much attention to is the fact that this mistrust can be bad, but this mistrust can actually be useful. So mistrust in and of itself, and I wish we could pull this up a little bit. You guys can see. This mistrust is actually, I'll go ahead and talk through. So this mistrust is actually leading to resilience, and it's actually leading to empowerment. And we wrote about this recently, and I think most people don't necessarily see it that way. They think it's something negative, but actually what happened is that mistrust is a protective and adaptive survival mechanism in the face of oppression. It can lead to resilience, it can be an impetus for mobilization, and it actually can empower individuals. So what did we see here in Boston? Now I cannot do it. Okay, there we go. So here in Boston, what we saw is that we had coalitions of individuals, like the Black Boston COVID Coalition, or like La Collaborativa in Chelsea, and then other places around the country, we saw indigenous folks doing this work. But I was actually a part of these initial Black Boston COVID-19 coalition discussions, and what they were framed around is this issue of mistrust. If we feel that people aren't going to do for us, then we are going to do for ourselves. And that was a powerful mobilizing force, very powerful. And in many ways, we harnessed that at the Boston Public Health Commission. We funded these folks and we got them to get boots on the ground and to mobilize people to actually be vaccinated, which has been incredibly important. So I wrote about some of this last year. And what I was saying goes back to that definition of structural racism, where I said it's about hierarchy, it's about privilege, and it's about power. So if you shift decision-making power to these groups, to people who are in the community, to the people who are most impacted, that is where things will change. That is how you change this dynamic. And if you do so, you should do so intentionally. And like I said, under the auspices of racism as a public health crisis. So as we look at what we could be learning from this, because I think a lot of people have been writing about what we could have been learning from COVID-19 and what we should take if we move forward, it's this idea of community mobilization, community empowerment, and change creation. And what it is you do to get people to do the work that they know that they need to do to change their own community. It's not about you leading, it's not about the public health department leading, it's really about community. So towards the future, I think we need to continue to focus on racial equity and social justice. Certainly we need sustained momentum and funding, which we don't really have right now, but we're working on it. Certainly we need to be investing in community coalitions. We need to work on our trustworthiness and transparency. Even though I said mistrust mobilizes people, we still need to be trustworthy as an organization. And then we need to apply the lessons learned from COVID-19 and from all these other crises to other health inequities, like this issue of life expectancy that I mentioned at the top of the introduction. And so finally, a couple things. One, I talked about symbolism and symbolic gestures. Symbolic gestures can lead to measurable change, and I tried to give you some examples of how that actually works. Approximately $4 million is now a part of our annual city appropriation. So the $3 million we built on that through the new administration. And so now we have that money. So the question is now, what are we going to do next? What we'd like to do is focus in on restorative justice. We'd like to think about reparations. We'd like to think about how can we do something novel moving forward that hasn't been done before. And I think that's the future, being visionary, being sort of thoughtful and innovative about how we can actually change and how we can actually act on this as another public health crisis. So it's not just about symbolic gestures, it really is about action. So I want to thank Mayor Wu and my colleagues, and thanks to Trinity Polk, who's the Director of our Office of Racial Equity and Community Engagement, because she's really been doing this work for longer than I have. And I'll take any questions you have. I'd like to start out with a question here that your question is two parts. One, for us as individuals, what is our role? And then we all are coming from institutions, health, academic, and other institutions. What is our role institutions and what is our role as individuals? So I think that's a great question. When I usually give this similar lecture to my colleagues, whether they be trained fellows or my peers, what I do talk about is what we can be doing individually. It isn't just about what's happening at the system level, though we tend to talk about structural racism as so it's this big behemoth that we can't really do anything about, we can't affect change. One of the things that we can do is be structurally humble and be structurally aware and actually understand that this is what's happening. And actually realize that racism in its many levels and its many forms is leading to the morbidity and mortality disparities that I mentioned. I don't know that all of us are. And I think I spent a lot of time having to justify that to a lot of people. So I think that's incredibly important. I think the other thing is, if you are a healthcare practitioner, irrespective of what it is you do, if you work with communities, understand mistrust. Okay, get that. Acknowledge it. It's okay. Like I said, it can work in your favor in some respects. and understand that you yourself, I don't care if you're the same race or ethnicity of the person you're talking with or the community that you're with, you can still be a trusted messenger. You can be transparent, you can be open about what you know and what you don't know, and you can actually engage people in a meaningful way. So I think that's one thing that we can do as individuals. I think at institutions, we need to get our own shops in order. You know, I mean, that's just real. And I think there's a lot of work that's going on within institutions to do that. I provided, you know, in that slide some bullets as to what we're doing, but the reality is that there are so many things that we can change, that we actually have control over, that we should be doing, that for a variety of reasons we're not. And I think that goes back to the definition that I gave of structural racism. It's about hierarchy, it's about privilege, and it's about power. And I think when you think about how to change things, that means some people are going to lose power. Okay, that means power is going to be shared across a lot of different people. And I think that can be scary in many ways. But that is what we need to be doing. We need to be thinking critically about what it means to truly change institutions, to truly make leadership decisions that mean that, you know, you have the first of this, that, the other, who are actually leading things because they're bringing something to the table that's novel, that's new, and that will lead us in the direction.
Thank you. Any questions or comments? I will let you know, Dr. Ojikuchi, that the online part of the Q&A was from Mary Twinman. Who said one?
Oh, thank you. It's a great endorsement.
There is another comment that hopes that the Boston Public Health Department implements their values that focus on community involvement and begins to listen to our neighbors and community members. And so I think supporting what you said as we move forward and reinforcing this idea about where is community and community. I want to thank you very much. Thank you. I can guarantee you. Thank you. Thank you very much for that. And thank you for that presentation. And I think the other part for me is that this award is in alignment with this idea of what our institutions can do. How can we hold up and recognize individuals who've been doing this work? How can we support the work that they're doing through things such as awards, but through things such as the medical school and the promotion policies for our faculty? This now can get recognized and count towards promotion. So again, how do we move this beyond just words to actual action? And so with that, I'm delighted to introduce and present our 2022 Equity, Social Justice, and Advocacy Award recipients. As we said, this award was to establish and recognize faculty, staff, and students trainees at Harvard Medical School and Harvard School of Dental Medicine, individuals from our Quad and the Longwood area, as well as our HMS affiliates, who advance equity, social justice, and advocacy, and contribute to and affirm HMS's mission, values, and diversity statement. Some of the logistics for today. The award recipients and presenters, I will introduce them. There's going to be a varied format. Some of this will be virtual, and you'll see videos. Some of it will be in person. We'll go back and forth. Teresa has done an amazing job of pulling this together. It's very clear, and I believe in my capacity to mess up what she's pulled together. So just be kind to me. The two trainees are recipients of this ESJ's award, and I have the honor of introducing our first trainee recipient, Dr. Jeffrey Edwards, who is a clinical fellow in medicine in the Department of Pediatrics at Boston Children's Hospital. Recognizing the fact that Black and Latinx adolescents had vaccination rates lagging behind their white and Asian counterparts in Boston, pediatric residents from the Boston Combined Residency Program partnered with Boston Medical Center's mobile vaccine clinic to kickstart the Ask a Doc program. The overarching goals of the program were to counteract misinformation and engender trust, something that Dr. Ojikuchi talked about within Boston's marginalized community, especially in Black and Latinx communities. Dr. Edwards and a team of residents coordinated clinics in conjunction with the community engagement team at Boston Medical Center, reaching out to Boston Public School leadership to plan vaccination events at each campus, first focusing on schools with the lowest vaccination rate and highest proportion of Black and Latinx students. They created a frequently asked questions document and a fact sheet used to prepare residents staffing the events and brief them on COVID-19 vaccine development and safety advocacy. And they set up and staffed a physical booth, answering questions from community members during 2-hour shifts. In less than 6 months, the Ask the Doc resident physician staffed 34 community vaccine clinics in 15 different zip codes in Suffolk County. Additionally, the program partnered with and delivered vaccine at 22 schools and insisted in delivering over 900 vaccine doses. It is an honor to present this award to Dr. Jeffrey Edwards. Congratulations, Dr. Edwards. I don't think so. All right, now you have the prototype. The award.
Much, Dr. Reed. I really appreciate the introduction and again, it's honored to be here. I'm so humbled to receive this award along so many advocates that I admire and so many personal role models. I've once heard it said that advocacy means to do 2 things: 1, to listen, and 2, to do something about it. And so it brought me such great joy to be able to do something about the inequities that we are seeing in vaccine rollouts, just as we had heard from our keynote speaker. And so it was just a wonderful partnership that we had with the Boston Medical Center outreach team and vaccine team that allowed any of this to happen, as well as support from our program, one of whom our Chief President, Bobby Rosen, is also being recognized today for his support alongside Colleen Kelly. And so thank you to everyone. Thank you to the members of Boston's community who allowed us to come in and enter their spaces and lended an open ear, and that allowed us to have this just a time to grow together. And thank you so much.
Our second training recipient is Dr. Robert C. Ray Rosen. Dr. Rosen is a clinical fellow in the Department of Emergency Medicine at Boston Children's Hospital. Dr. Amy Starmer will present Dr. Rosen's award. Dr. Starmer is a Harvard Medical School assistant professor of pediatrics. Is also the medical director of Boston Children's Hospital's Clinical Pathways Program and associate medical director of quality. Dr. Rosen and Starmer, please join me at the podium.
Alert back, please.
All right, I'll look like.
All right, run the smiles in the back there.
Great pleasure to have this opportunity to introduce you today, Dr. Robert Rosen, who is receiving this award in large part due to his leadership efforts on a large multi-stakeholder project to examine the extent to which race and ethnicity were included as part of the clinical decision-making process within the Boston Children's Hospital Library of more than 132 clinical guidelines. Dr. Rosen's leadership on this effort included conceptualizing the objectives of the project, identifying and recruiting the many involves stakeholders, designing a structured framework to guide and facilitate guideline review, and communicating the working group's findings and achievements across our health system as well as on a national level. Prior to this initiative, Dr. Rosen's career had similarly focused on social justice and advocacy, addressing food insecurity, homelessness, and global health and development. On a personal note, it's been a true honor to have the opportunity to collaborate in the context of an ideal, mentee-driven partnership with someone who is as tenacious as he is humble, as kind as he is ready to challenge a controversial point, and is open to feedback as he is eager to make sure that email gets sent as quickly as possible to keep things moving forward. Congratulations, Dr. Rosen. Very well earned and deserved recognition.
Thanks, everyone. It's an honor to be here with you today and to be in the company of so many others whose work has benefited our patients and families. I may be standing here today, but this award really goes to more than 30 members of our working group who dedicated their time to our effort over the last 1 to 2 years. And it especially goes to 4 advocates in particular, Doctors Alex Epibunia, Glenn Bocino, Joanna Perdomo, and last but not least, Camila Mateo, who seems to be doing an awful lot of good these days and is herself being recognized today for other work. Those 4 physicians called for a review of race and ethnicity in our clinical pathways library in 2017 before this issue gained national attention, and we're here because of them. I'd also like to acknowledge our hospital chief equity and inclusion officer, Dr. Valerie Ward, and the chief quality and safety officers, Dr. John Finkelstein and Sarah Tooney, who championed this work. And of course, my mentor and co-lead, Amy Starmer, for her guidance and her belief in me and us. Our efforts sought to operationalize our understanding of race as a social construct and ensure that that understanding is reflected in the way that our clinicians think and practice in their everyday work. And it's the first step on a journey to build health equity into everything that we do, and makes me hopeful for things to come. So thank you very much.
Thank you very much and congratulations, Bobby. We now recognize Ms. Renelle Walker-White, our staff recipient of the ESJ Award and Associate Director of Health Equity Programs for the Family Van. Ms. White's award will be presented by Dr. Molly Williams, HMS Lecturer on Global Health and Social Medicine and Executive Director of the Family Van.
Good afternoon. I'm honored and humbled to introduce Renelle Walker-White, the staff recipient of the Equity, Social Justice, and Advocacy Award. For 30 years, let me repeat that, for 30 years, Renelle has served our community with a fierce commitment to equity, trust, and access to care. Under Renelle's leadership as Associate Director of Health Equity Programs, the Family Van not only serves the residents of Roxbury, Dorchester, and East Boston, we also serve the Longwood community. Renelle teaches by example, showing students and volunteers how to care for people through radical listening. During her time on the Family Van, she has trained more than 1,000 students and volunteers, cared for no fewer than 57,000 clients, and touched the lives of countless family members, colleagues, and local clinic leaders across the country. Raynell's passion, perseverance, and faith teaches us to understand each other better, not with judgment, but with openness and compassion. Raynell, on behalf of the entire team and all those whose lives you touch, thank you.
Thank you so much, Molly. Thank you all for that warm welcome. I'm going to first and foremost give honor to my father and Kevin. I could have not done any of this work without him because he has instilled in me a heart for the people. I thank the family band. I thank Nancy Oriole, who is the founder of this program, who started it and really gave me a chance to be able to take the work that I know so deeply and care so deeply about into the lives in the communities of the people that I serve. I wanted to just sum this up, and I'm not going to talk long. I just wanted to sum it up with the word love. And I'm going to say, the band meets the needs of individuals each and every day. 30 years of reaching many, many people who seek out help, love, and a listening ear. No man is an island, no woman is an island on their own. I could not have done this work without my staff, the community, the partners, and all of those who have worked alongside of us. When I think about love, I'm going to sum it up like this. L is for listening with your heart and offering of yourself to be present and learning from others as you impart wisdom and as you take in from each and every person. Impart wisdom and understanding. O is by being open. Always be open for change, open to be able to see people for who they are, open to being yourself and standing by yourself sometimes when you feel like you're the only one there. B is for being the voice, being for the voice of those people in the community who do not have a voice. Stand up, open up your mouth, say something so somebody else can be helped. And E, this work is endless. It's endless, but then at the same time, it's encouraging. And I know because I've done it for so long, I want to give my husband, Cedric, a welcome, an applause as well. He's been with me for these 30 years. He's been my biggest cheerleader. And I just thank him for encouraging me to stand and always be able to be there for somebody else. Love, let's take it wherever we go. We need it. Thank you, Maria. Our first recipient of the Student ESD Award is Dr. Parsa Afani, who joined us by Zoom. Dr. Fanny Afani was a medical student at the time of the nomination process, but graduated in 2022 and is now a resident physician in the Department of Internal Medicine at Brigham and Women's Hospital. Dr. Afani will be introduced by Simadeo Fadego, HMS instructor in medicine in the Division of Oncology at the Dana-Farber Cancer Institute. And so we're going to see Dr. Fadego's two recorded remarks on the screen, and then Dr. Afani will also be joining us by Zoom. My only thoughts were if I had to do this myself.
Thank you for this.
Thank you for this opportunity to introduce Dr. Parsa Irfani, whom I've worked with for over 3 years. Parsa is very driven to improve the lives of the most marginalized by addressing both individual and systemic barriers to accessing equitable healthcare. This drive has led him to pursue truly impactful research projects centered around advancing social justice. I have worked with him on several global oncology projects related to streamlining and expanding access to cancer diagnostics in sub-Saharan Africa. Specifically, he led a cost minimization study comparing the costs of breast cancer diagnosis using standard pathology versus a novel molecular platform that is widely available in Africa. This important work can lead to more equitable access to breast cancer diagnostics across low-resource settings worldwide. He's an emerging leader in health equity research and very well deserving of this honor. Thank you.
And we're now bringing Dr. Irfani.
Yes. Hi, Dean Reed. Can you hear me? Hello?
Can you hear me?
Oh, yes, I can hear you. Can you guys see me? Okay, amazing. Well, thank you so much and for the flexibility in terms of engaging me into the ceremony today. I'm honored to receive it alongside everyone else here today, seeing the decades of work of people committed to this justice work. My time as a medical student and now as a trainee, I've been consistently reminded of how amazing modern medicine is, how we push the boundaries of science to prevent suffering and cure disease. But the most challenging part of the training and working in communities locally and globally has been being confronted with the reality that some get to benefit from the fruits of modern medicines while some do not. As an intern, I see this every day by who's let in our hospital doors. And as an immigrant and global health advocate, I see this in the global South, where patients die needlessly from curable diseases due to lack of access to medicines and healthcare systems. I thank the patients, the advocates, and the mentors who have challenged me to help reorient medicine into a field that is not just committed to technology and innovation, but one that is centered around restorative justice and intentional about who gets to benefit from these advances. Thank you so much for having me.
Stay real.
You are creative. You are creative. Congratulations, Parsa. Our next student recipients have been advocating for equity and social justice in tandem. I'm pleased to introduce Mr. Jordan Kondo, Harvard Medical School MD candidate for the class of 2023, Ms. Meghana Mishra, Harvard Medical School and Harvard Chan School of Public Health MPH candidate for the class of 2024. Dorgan and Megana became engaged in nutrition policy and advocacy in Massachusetts at the start of the COVID-19 pandemic. Given the rise in food insecurity during the COVID-19 pandemic, especially among vulnerable patient populations, they began searching for ways to better integrate food security into the healthcare system. They started following two bills, S 1403 and H 2298 in the Massachusetts State House, that would create a first in the nation food is medicine pilot program to test the efficacy of providing food is medicine services for mass health patients with food insecurity and diet-related chronic conditions. Megan and Jordan submitted a policy resolution to the Massachusetts Medical Society in support of interventions resulting in the mandated advocacy of the MMS for regulatory efforts promoting food is medicine. Both also began advocacy related to the Massachusetts SNAP gap and the barriers that low-income individuals face in applying for needs-based benefits, such as supplemental nutrition assistance program, SNAP, in Massachusetts and Mass Health. Megan and Jordan collaborated with community-based organizations and then created a medical student and physician letter signing campaign in support of two bills. The passage of the bill would create a common application for the supplemental nutrition assistance program, Mass Health, and other safety net needs-based programs in Massachusetts. With over 400 signatures and support from our hospital affiliate, Tufts, UMass, the letter was delivered to the Massachusetts legislature in January of 2022. We applaud their outreach drive and their health equity and policy advocacy. And it's my honor to present this award to both. Congratulations. Afternoon, thank you, Dean and members of the Office for Diversity and Inclusion Community Partnership. It's truly an honor to be here among everyone, and I'm really to receive this award alongside Megan. As a medical student, it's a real privilege to take care of our patients, to hear their stories, to support them, and when we are able to advocate for them. When I first started medical school, on the topic of advocacy, a classmate inspired me with his words, "If not you, then who?" During the COVID-19 pandemic, when Megan and I saw food insecurity rise to its highest levels, we were reminded of these words. And consequently, together, we've been able to be part of a team to advocate and help direct support for important food security initiatives such as food is medicine, universally free school meals, improving SNAP access. But along the way, we've been able to draw from incredible support and strength from mentors at HMS, mentors like Amanda Stewart at Boston Children's, who inspired Megan and I to use our voices to advocate for our patients and legislators. I'd like to thank my partner in our work, Megan, as well as Sanjay Gadi, Nisha Paul, David Velasquez, Matt Townsend, and Pat Baker for helping me navigate the health policy landscape. And lastly, I'd like to thank my family for their continued love and support over the years. Today, I'm inspired and encouraged to be part of a community who strives to make sure no patient is left behind. Thank you.
I'm Dr. Thank you for being here, and thank you to all the members of the Office of Diversity, Inclusion, and Community Partnership. It is a tremendous honor to receive this award alongside these other wonderful recipients. As a medical student, one of my biggest contributions in the hospital is simply to be present with patients, providing companionship and a listening ear. In this role, I've had the privilege to bear witness to the stories and the struggles of the most vulnerable among us. Struggles ranging from homelessness to food insecurity and beyond. It is these stories that continue to inspire me every day. Our patients don't just need medical care, they need support outside the four walls of the hospital. And I hope that Jordan and my work on food insecurity has been one small step in service of this mission. Along this journey, I'm so grateful to have had support from many amazing individuals. First and foremost, I'd like to thank Jordan, who's been my partner in this work since our first year of medical school. And next, I'd like to thank my professors and mentors from college, particularly Professor Ron Scheiko, Ann Sosin, and Sadhna Hall. They were the ones who first introduced me to policy and advocacy work, and I wouldn't be here today without them. And I would also like to thank our mentor at HMX, Dr. Amanda Stewart, who taught us how to elevate the stories of our patients into the legislature. And finally, I'd like to thank my family, especially my mother, who showed me from a young age what it means to advocate for your patients. The past few years have shown us that much work remains to be done in this area, but I'm thankful to be part of this community that has shown such commitment to health equity for all. Thank you.
Congratulations, Nagana. It's my pleasure to now introduce our first faculty ESJ awardee, Dr. Avery LaChance, who will join us via Zoom. Dr. LaChance is a Harvard Medical School Assistant Professor in Dermatology in the Department of Dermatology at Brigham and Women's Hospital. Dr. LaChance is being introduced by Dr. Vinod Nambudiri, who's an assistant professor in dermatology in the Department of Dermatology, also at Brigham and Women's Hospital. And Dr. Nambudiri also joins us via Zoom. And I turn to you to make this work.
Great. Thank you, everyone, so much for the opportunity to introduce my wonderful colleague and friend, Dr. LaChance. Hoping you can hear me clearly. Dr. LaChance completed her medical training at the University of Connecticut and a master's in public health at the Harvard School of Public Health. And I mention this because Dr. LaChance has truly been an advocate and active in the health policy arena since her time as a medical student, when she was instrumental in helping Connecticut pass the legislation to prevent teen tanning bed use. And from that time on, she has had a rich and storied and extremely impactful career impacting health policy for individuals across multiple states and the entire country as well. Here in the Brigham Department of Dermatology, Dr. LaChance serves as the director of the Connective Tissue Disease Unit, working with patients who have often struggled to identify the right diagnoses, and really serves as a true champion for treating and diagnosing these individuals, as well as our department director of healthcare policy and advocacy. I also have the privilege of serving as the co-director with Dr. LaChance of the Harvard Dermatology Residency Program Equity Track, under which Dr. LaChance has done heroic work to help bring a community of individuals from across the Harvard Medical School system together to really engage with important, challenging topics in health policy and equity. But beyond that, Dr. LaChance is really being honored here today for her work as the founder of the Massachusetts Dermatology Trainee Advocacy Day, now having successfully completed 3 years of this wonderful activity, bringing trainees, faculty, residents, medical students to the State House to directly engage with our legislators and to directly impact policy for individuals in our state struggling with a number of critical health equity and access issues. The agenda from this most recent year tackled such important topics as the Crown Act, which seeks to end hair-based discrimination, both in Massachusetts and nationally, as well as step therapy, providing access to our patients for the medications that they most need. And finally, strategies to increase and enhance diversity, equity, and inclusion in the field of dermatology, which has struggled with these areas and concepts in the past. Dr. LaChance's work has been seen as a model for other states who have now adopted this advocacy model and Trainee Advocacy Day in multiple other states after having seen the success that Dr. LaChance has launched here in Massachusetts. And we're so proud and honored that she is a member of our department and of HMS faculty here. So I'm thrilled to introduce Dr. LaChance, who I'm proud to call a friend, a colleague, and an inspiration. And I can't think of anyone who I work with who is more deserving of this award.
Thank you so much, Dr. Anambudiri, Dr. Reed, and the entire team for having me today. I'm so humbled and honored to be a recipient of this award, and really just want to say a huge thank you to my department, for supporting me in this work, to the Harvard Durham residency for supporting me in this work, and to my amazing colleagues, including Dr. Anambudiri, who I get to work very closely with to allow some of these initiatives to move forward. As I was reflecting on this, the privilege of this award, I was really just grateful to think back on, mostly the number of trainees that have come together to really push this work forward. And each of these initiatives has really been driven by so much love, passion, energy, excitement by a number of, like I mentioned, my colleagues, but medical students and residents. And I'm so excited and energized when I see that the next generation of physicians coming and physicians to be really espouse this work in every single thing that they do, and really drive this forward with so much energy, which makes it such a joy to continue this work onwards. And the reason I'm actually home and virtual today is that I'm actually on maternity leave and have a brand new, beautiful daughter. And when I think about her future and the work of health equity moving forward, I'm really hopeful for all the work that everyone is doing to see the next generation of equity and social justice be pushed even further. So thank you all for this honor, and thank you for allowing me to be here virtually. And it's such a true joy to be here with you all today.
Wow, the next Academy Award. Thank you, Avery. Our next faculty award recipient is Dr. Wendy Macia, Assistant Professor of Emergency Medicine at Harvard Medical School in the Department of Emergency Medicine at Massachusetts General Hospital. Dr. Constantinopoulos is being introduced by Dr. Michael Van Royen, Chair of the Department of Emergency Medicine at Mass General Hospital. Dr. Van Royen, Dr. Constantinopoulos, please join me at the podium.
Thank you, Dean Reed. Thank you, Dr. Okikuchi, for your wonderful remarks and for this really wonderful show. Thank you. It's really terrific to be here. And those of us who work in emergency medicine really identify with the job that we have of taking care of people that suffer from tremendous social strain and tremendous inequities at the worst moment of their life. And we all identify with that, but nobody identifies with that more closely, more keenly than Dr. Masias Constantopoulos, Wendy, who has more titles than syllables. She serves many functions in our emergency department, but one of them is being the director of the Center for Social Justice and Health Equity. And Wendy has had a really wonderful way of identifying a problem, seeing it clearly, studying it, making us change the way we take care of patients with those issues, and then making the rest of the world do the same. And so she's done that in so many aspects. One particular one that we faced during the COVID epidemic was this issue of crisis standards of care. Those are actually, the short term for that is rationing. And we were facing the pretty crazy scenario that we're gonna have to ration care for patients suffering from COVID. And when we ration care, we were really quite afraid that we would ration care based on negatively on social determinants of health and inequities. And she stood up and made sure that we adopted policies and procedures both locally, nationally, and across the state and elsewhere to make sure that we faced issues like that and many of the health disparity issues that we face, and do so in a way that really is attentive to the social determinants of health and the potential for health equity, health inequities. And then really importantly too, she has a heart for some of the most complicated and most difficult circumstances that we face in the emergency department. And in particular, she's really noticed and made tremendous strides in the issue of abduction, trafficking, and abuse of children and women. And in so doing, we see those issues in the emergency department in a way that is catastrophic, difficult, and in a broken system, almost impossible to fix. And yet she started the Freedom Clinic. She's that to attend to those issues, to give women and those really fleeing from sexual abuse and exploitation a place to go. She's also studied it and promoted policies nationally. She's a national leader in policies as it relates to human trafficking. And so it's humbling for me to be a chair and to have someone so passionate and powerful. Don't let her really kind, nice, lovely, wonderful demeanor fool you. It's a veneer, because underneath she is a fierce advocate. So it's with great pride that I have this one.
So I am humbled to be here among all of you, among the distinguished awardees today. I want to first thank the Harvard Schools of Medicine and Dental Medicine for establishing this award in recognition of the profound role that advocacy can play in the success of communities and society in general. I extend my deepest gratitude to you, Dr. Reed, and members of the Office of Diversity, Inclusion and Partnership. The work that you have extended over the years, your vision, your trailblazing, and unrelenting efforts in this space really set an example for the rest of us. I'd also like to thank my department, who has supported my many non-clinical efforts over the years, my colleagues who nominated me, all those who are equally deserving of this award today, and especially my colleagues, Drs. Alistair Martin, Andrew Marshall, Onyeka Otobu, Oni Becky, Hazar Kadiri, Joanne Suarez, with whom I have the privilege to share this great honor today, and without whom we would not have been able to so effectively advocate at the state level for more equitable and just crisis standards of care in the midst of a devastating pandemic that threatened to overwhelm our healthcare system and leave the most underserved and systemically disadvantaged among us even further behind. Ensuring a more diverse, equitable, just, and inclusive community is not the work of the few, but rather the work of everyone who values and understands that there is strength in diversity. There is no single prototype that we should aspire to be. Every version of what it means to be human matters. Every one of us brings value to the table through our diversity of thought, culture, experience, perspective, strength, and ability. It is through this rich diversity that we continually evolve as a human race and attain progressively higher levels of achievement. Today, not only do we celebrate the many efforts of those who are here today, but we also honor and recognize the critical role of diversity and excellence.
Congratulations. Our third faculty award recipient is Dr. Camilla McHale. Dr. McHale is the Morgan Winter Associate Director of Faculty Development and Inclusive Teaching and an instructor in pediatrics at Harvard Medical School in the Department of Pediatrics at Boston Children's Hospital. Dr. McHale is being introduced by Ms. Kayla Boyd, a Harvard Medical School MD candidate in the class of 2022. Dr. McHale and Ms. Boyd, please join me at the podium. Black is spirit color.
Everyone, I have the immense pleasure of introducing Dr. Taylor. And she's on behalf of myself, but also many of my peers, in saying that her efforts have really been transformative, helping to ensure that the individuals and spaces and the curriculum that make up our learning environment are welcoming to students of all backgrounds. Dr. Taylor's work as the Associate Director of Faculty Development and Inclusive Teaching and Anti-Racism, and in her role as a leader for essentials of the profession course, second one. She really teaches us how we can be agents of change, and also how we can incorporate principles of health equity into our future practice as health providers and as future health educators. Dr. Mateo has contributed so much to individual students and also to many of our community groups. I had the pleasure of working with her through one of the multi-racial task force, the FMA, in social intelligence. It was a really special experience because not only did she really teach us a lot about sort of medical education and help us design proposals for ways we could help us through the curriculum, but she empowered us the entire time and really reminded us how much our voices matter. Our ideas as students is really important. And then the last thing I'll say about Dr. Mateo, even though I could say a lot of wonderful things, is that she really has a heart of gold. I think that there's been times where at HMS I just feel lost, but I know I can turn to Dr. Mateo as a mentor and as our on-the-back advisor. He is a space of belonging for everyone.
No. Oh gosh. Go ahead, wow. Sorry. Thank you so much. That was very surprising and lovely. Thank you so much, Kate, for such a beautiful introduction. I'm really just so honored and humbled to be recognized in this way. You know, the work that I do is work that is meaningful to me and that I want to do all of the time. And I don't want to speak for others, but I think that's true for others here too. I'm humbled and honored to really be recognized next to such wonderful people and by such wonderful people. And I think that moments like these and situations like these where we can be recognized and stand here representing a collective effort to do this work, right? Like every time I'm able to do some of this work in a way that feels like it really landed and made an impact, it's because of a giant collective of people who have been able to enable me to do the work and also who are co-conspirators in that work. And so I want to thank you know, my family, my friends, my colleagues, my learners, They're constantly teaching me, for helping me and enabling me to do this work, because I feel like sometimes it can be hard. It can be tough to kind of continue to do it, and being able to have moments where we can be in community like this and really appreciate one another in such a warm way is just such a boon. And so I'm so thankful for this opportunity. Thanks so much. I want to thank you, Taylor, and congratulations, Camilla. Our final ESJ award is our first Lifetime Achievement Award for Equity, Social Justice, and Advocacy. And this recognition is awarded to Dr. Richard Malika. Dr. Malika is a Harvard Medical School professor of psychiatry in the Department of Psychiatry at Massachusetts General Hospital, and is being introduced today by Dr. Eugene Augustifer, who is Deputy Director and Director of the Telemedicine at Harvard Program in Refugee Trauma and the Harvard Global Mental Health Program in the Department of Psychiatry at Massachusetts General Hospitals. Dr. Malika and Mr. Augustifer, please join me at the podium.
First, I'd like to thank all of you for being here. I'd like to thank Teresa. I'd like to thank Dean Reed for this special occasion, which is really special to us. And I want to introduce Dr. Richard Malika to you all in a little bit more detail. So I'm going to read my notes. So I don't leave anything out if you don't mind. So it's my distinct honor to introduce Dr. Richard Malika, the first winner, as Dr. Reed just said, of this Lifetime Achievement Award. I can't think of anybody more deserving than Richard for his lifelong work with people who have been neglected and overlooked, and he's really been a champion through the years. As a psychiatrist and professor of psychiatry at Harvard Medical School and Mass General Hospital, Dr. Malika has devoted his entire career to bringing first-class mental health care to those populations that have been neglected and overlooked. His advocacy began when he was a young medical student and resident at Yale, working with Dr. Fritz Redlich, who co-authored with August Hollingsworth a landmark study in the 50s, the social class and mental illness, which was really a landmark study for those of you who haven't ever read it. It's worth a read. Dr. Malika followed that up 25 years later in the early 80s with his own study, which he was a team lead on. Following that study, his study from asylum to community, the threatened disintegration of public psychiatry, which was published in the New England Journal of Medicine in 1983. He has a number of different awards, and this one's one of the best that I've seen for sure, but I'd like to say something at a personal level. So I represent the whole team of HPRT, Harvard Program in Refugee Trauma. I'm standing up here today representing some of our team who are here today. On the personal level, I can say that we've had the good fortune of working with him. We all cherish his kindness, his ability to be a wonderful teacher and mentor to all of us, and also to share his knowledge and wisdom with us. I'm thrilled to represent our team and inviting Dr. Malika to the stand right now. Richard? Okay. Well, thank you, Eugene. Oops. I want to, oh, okay. At my age, I actually got a lifetime achievement. I want to thank Dr. Reed and Teresa and especially my colleagues who won these awards for giving us great hope that things can change. Things can change. And we're at that moment now with this dark period we've been in with so many crises going on globally that our colleagues gave us hope today and gave us sunshine. We stand in bright light of our colleagues here today. Thank you so much for your wonderful work. I just want to say a few things about our work. 40 years, 4 decades. Can you imagine trying to summarize 4 decades in a couple of seconds? But I want to say it's with great honor and humility that I accept this award on behalf of the Harvard Program in Refugee Trauma. The Harvard Program in Refugee Trauma was founded in 1981 with our clinic, which was one of the first refugee clinics in the United States at the Brighton Beach Public Health Center. And it was our mission, our team, and our team's still together. Our team is still together. I see one of our founders here in the third row in the back, you know. Our team is still together. It was our mission to serve highly traumatized refugees who had experienced mass violence, torture, and sexual abuse. Over time, it became our dream to place refugee mental health on the international, national, local policy agenda, to integrate refugee mental health into mainstream medicine, and to create a local healing environment for thousands who had experienced unspeakable violence. In our clinic alone in Boston, we've treated over 10,000 survivors of torture over the past 3 decades, over 10,000. And we're very instrumental in helping to make rape and sexual violence a crime against humanity, not a criminal act. We played a role in that, and I'm very proud of that. You know, with this award, our dream has become a reality. Now, I want to thank my colleagues who are listening from other places in the world, my colleagues here from HBRT. I want to honor them because there would be no HBRT, no 40 years of work without these incredible people, our partners throughout the world. And I just want to spend 1 minute thanking them. Our refugee patients and their family members, most important. Our refugee patients and their family members who we developed, we became family. Really, we became. The Cambodian community, most of them lived through the Pol Pot genocide. Our Italian mentors and colleagues are listening now from Italy, who believed in our mission from day one and said, Richard, we have absolutely no idea what you're doing, but we're 100% behind it. That's real faith, right? And trust. You know? And they stood behind me for 40 years. Our Italian colleagues. Our wonderful, incredible partners in Japan, Peru, Cambodia, Liberia, Lebanon, Sarajevo, Haiti, Australia, and the Vatican. The U.S. Office of Refugee Resettlement. And finally, the leaders of the HMS Division of Continuing Medical Education at Harvard Medical School, who believed in our training 18 years ago, who believed in us. We came from nowhere and said, let's do it. We're backing up, you know. And also the Mass General Hospital Department of Psychiatry, who believed in our mission. As our wonderful young colleagues at HBRT say, there's no dream work without teamwork, right? No dream work without teamwork. I stand here to accept this award on behalf of our team, many who are here in this audience. Finally, I'd like to thank my wife and mentor, Dr. Karen Carlson, and my sons, Nick and Chris, who supported HPRT on this challenging and sometimes dangerous journey. Thank you.
These are very heavy. I think people are putting them down. Because I'm watching the front row, people are. Congratulations, Richard. To each of you, faculty, students, staff, and trainees, we as a community say thank you. Thank you for your insight and drive, for your determination to correct injustice wherever you see it, for your vision for equity, your heart of justice, and your conviction for advocacy. To our attendees online and in person, I present to you the 2022 Equity, Social Justice, and Advocacy Award recipient. Equity and social justice are about much more than race or gender or sexual orientation, age, class, language, ability, where you live. They are about all of us. They are about creating the space to be impartial and for all to receive just treatment, just action and opportunity. Within our Harvard Medical School, Harvard School of Dental Medicine community, we can stand sure-footed in our HMS mission, our community values, and our diversity statement, raising our voices in support of efforts that advance equity, promote social justice, and advocate for us doing what is right. If we look at our mission, we are charged to nurture a diverse, inclusive community dedicated to alleviating suffering and improving health and well-being for all through excellence in teaching and learning, discovery and scholarship, service and leadership. We've seen through the efforts of today's awardees that when we are unified, when we work together, we can reach higher, and that we are truly better together. As we close, for those online, please remember to take the poll, but also stay for the thank yous. I think Dr. Ginobili and Dean Ginobili and Dean Daly for their support of this effort. Our Harvard Medical School and Harvard School of Dental Medicine community for their participation. Dr. Bissell for your motivated presentation and your long-standing commitment to this work. To the staff of my office, the ICP, for managing this award process, and particularly to Teresa. To the Harvard School of Dental Medicine staff of HMS Media Services, thank you all for making today possible. Thank you for joining us today. Please stop in the lobby for the reception. Thank you.
Would all of the award recipients please stay in the room for a group photo? And we're going to pull up on screen our two recipients that are online. Will all of the award recipients please come to the table with your award? Would all of the award recipients please come to the table with your award? We're going to take a quick group photo with Avery, who is on the Zoom waiting for us.
Oh, they're okay, yeah. The flash is gonna override that, so I think we'll be okay. Try to just move it, folks, just a little bit off to the side there for our AV guy. Okay. And let's see if we get here, everyone right this way. My subject in the back, there she is. You got a smile on the back here on the screen. Yeah. All right. Good, right, we're gonna make it. So here we go again, 1, 2, and 3, everyone, and again, another one. 1, 2, 3, 4. But let me do one last one if I could. So we get this thing. Here we go. Thank you all very much. Without the screen. We turn the screen off. Yeah. Should we end okay.
Are they all set or?
Thank you.
Bye.